Worked at Centretown Community Health Centre in Ottawa for many years, and I would often have clients that would come in and say, very smart, intelligent folks who were newcomers, and they would always apologize and say, I'm sorry, I have an accent. And I had these great postcards on my door that I got from Access Alliance that said, everyone has an accent, and I would have those up, and so that's a little shout out to Access Alliance, because I used your resources to just, affirm that everyone's welcome here. Yeah. And if you're not familiar with the Alliance for Healthier Communities, here's my slide. Okay. It's a network of over 120 community-governed, comprehensive primary healthcare organizations across Ontario. So it includes community health centers, Indigenous-led primary health care, nurse practitioner-led clinics, and community family health teams. And our members share a commitment to advancing health equity through the delivery of comprehensive primary health care. They serve populations systemically marginalized and underserved by other parts of the health system. And our clients tend to be those who face the greatest barriers to health and the poorest health outcomes. So these organizations are team-based and typically deliver a range of clinical, allied health, health promotion, and social and community support services. So just to share, this is the model of health and well-being that our member centers operate under. So it's grounded in these principles of our model of health and well-being, which is rooted in health equity with a focus on enhancing collaboration between primary healthcare teams, health promotion, community development, to promote integrated and coordinated care delivery. And our Indigenous-led primary healthcare organizations use this holistic model of health and well-being. So I want you to take a moment and think about something outside of the healthcare that you receive that supports your well-being. Is there anything other than going to the doctor or going to the hospital that makes you feel good? Sports, okay. Anyone else? Is there anything that it contributes to your well-being or your health? Socializing, arts. Someone way back at the back? Family, yes. So I'm glad you took a moment to reflect, because when we talk about social prescribing, we're talking about all those programs and services that are non-clinical that can support someone's health and well-being. So there's many things that can support us in our well-being. So this is just a slide from the Canadian Medical Association, but it talks about how 25% of what makes you sick or healthy may come from your healthcare, but 50% of what makes you healthy or sick is your life, your determinants of health, and we look a lot at the social determinants of health. So education, employment, food security, income security, racism, colonialism, all of these social determinants of health have a really big impact on our health. So this is the pathway that we use at the Alliance to talk about social prescribing. So social prescribing, there's always a client, a unique individual who has their own strengths, their own interests, and then there's a prescriber. So that could be a healthcare provider that identifies some non-medical issues and makes a social prescription. And with a lot of our member centers, we're fortunate enough to have someone who takes on this link worker or navigator role. And it might be a health promoter, or it might be a nurse, or it might be a social worker. There's different roles. And then that person can take the time to sit with the client, find out what matters to them. So instead of asking, what's the matter with you, we ask, what matters to you? And that person can then help connect the client with those non-clinical programs and services, and we use data to track. So we have a common EMR, electronic medical record, with all of our member centers, and we have some custom forms and ways of tracking and measuring this. And then you can really see the impact of these non-clinical programs. So for example, when I worked as a health promoter, I ran stress reduction programs, and it was the difference between my clinical colleagues saying, oh, just go down the hall and try out Natasha's fluffy stress reduction program, and then when we started making it a formal referral through our EMR, they could see, oh, the client attended all 8 sessions, and then when I saw them again for their checkup, their anxiety was greatly diminished, and now I know why, because we tracked some of those non-clinical programs. So I'll give you a little overview of some of the projects we're delivering at the Alliance, and all of our social prescribing is health equity focused. So We started with the pilot in 2018, so we used the model that was being developed in the UK, and we had UK mentors come and support us. And we delivered this in 11 different CHCs across Ontario, and social prescribing looked different in each community because we were at urban centres, rural, francophone, and each centre knew what would work best for their community. But we were able to get some very promising results out of that pilot. And then we started our Links to Wellbeing, social prescribing for older adults. So that's been around since 2021. And it's a partnership with the Older Adult Centres Association of Ontario. And what our goal is to make a clear referral pathway from healthcare to community organizations such as the Seniors Active Living Centres and other community organizations. So trying to take some of the burden off of healthcare for some of those non-clinical needs. And right now we have just a huge, it's a province-wide project, and we have over 200 healthcare organizations partnered with us and over 200 Seniors Active Living Centres, so that partnership continues. Also in 2021, we started the Black Focus Social Prescribing. So this is looking at culturally affirming social prescribing to improve healthcare experiences and outcomes for Black Ontarians. And we worked with 4 centres to learn what would that look like. What does a social prescription that causes no harm and affirms Black culture, what does that look like? And we have a final report that we'll be launching very soon that has some amazing results from that work. We also did a project called Social Prescribing for Better Mental Health, which was an 18-month project funded by the Public Health Agency of Canada. And we worked on improving social prescribing pathways. So we funded 28 different organizations to deliver social prescribing, and we added this healthcare quality improvement coaching component to support organizations to implement and improve social prescribing. I'm just going to dive a little bit deeper into the social prescribing for better mental health, but our goals were to train service providers to implement social prescribing with a health equity lens. So we engaged in these coaching meetings and events, and we worked with 284 different providers. We wanted to identify people that were at greater risk of poor mental health after the pandemic, and then support them with use screening tools to identify them, and then support them to navigate them to mental health promotion programs and services. And then along the way, we co-designed, engaged, evaluated, and shared our impacts and learnings. So here's the next slide is a map of Ontario. So those are the 28 sites, so they were pretty widespread across Ontario. And then we did do a spread and scale project with 13 additional health organizations to receive that coaching over 3 months to help them with their social prescribing. So I'll just share briefly some results from our projects, and I would say that I'm a person with a big heart, surrounded by a lot of people in this room with big brains, so with our pilot, when we did surveys, and we found that 49% of the clients identified a decrease in loneliness, 12% identified increase in self-reported mental health and physical health, 19% reported an increase in social activities. We also saw really good feedback from the providers we were working with, where they saw decreases in primary care visits for non-clinical needs. So typically that client that keeps coming in and saying, I'm lonely, I'm at loose ends, I'm not quite sure what to do with myself, I just don't really have a reason to get out of bed, or some of those kinds of things, we were able to support some of those non-clinical needs through the social prescribing work. With our Links to Wellbeing in the first 3 years, we saw over 1,500 clients, and 40% reported improved connections to community and better self-reported mental and physical health, and 62% reported a decrease in loneliness over 12 months by attending the Seniors Active Living Centres and other programs. And then for the better mental health, we saw almost 3,000 clients in 18 months. 90% reported improved well-being after attending community programs and activities. 84% of the professionals or service providers agreed that social prescribing helps address clients' complex needs, and 72% of clients who experience barriers receive support to help them attend programming. So it's not just that you're going to the senior center, your membership fee is being covered, we're covering the cost of transportation. And I'll just give a little snapshot from our upcoming final report with Black Focus Social Prescribing. So one of the big pieces that came out with this project was, and in fact, across all of our social prescribing, food security is our #1 prescription that we make. But we definitely saw this with the Black Focus Social Prescribing. We worked with 4 centers, Taibu, Rexdale, Black Creek, and Somerset West, so 3 in the Greater Toronto area and 1 in Ottawa. And so the most common prescription was food security, followed by Black Focus community events, arts activities, connections to other programs and services. And what we found was that 88% of our survey respondents worried about running out of food before they had money to buy more, either often or sometimes. And in the past year, 40% of survey respondents reported not being able to afford balanced meals often or sometimes. And 87% of survey respondents agreed that Black Focus Social Prescribing made food available to them, and this was the only source of extra food for the clients that were part of this program. So it makes us think about what would prevent someone from going to a food bank or accessing food. Perhaps if it's not food from your culture, or if you don't feel safe or welcomed there, or maybe like what prevents people from accessing services even when they need it. And that's what we found with the Black Focus Social Prescribing. Our navigators were members of, not only were they Black themselves, but they were members of the community. They knew what community resources existed, and they were able to build really trusting relationships with their clients, many of whom, for good reasons, have a lack of trust in the health system due to previous bad experiences. So that was one of our big impacts. I'll just share a brief story from Black Focus Social Prescribing as an example of what social prescribing could look like. So we had a client who was living in a shelter, a recent newcomer to Canada, and she was talking about how she shared this story, and she said, you know, I was doing my high school program, but I did not want to go to the graduation because my hair looked terrible. I wasn't really leaving my room. I didn't feel good about myself. And then I heard about this black hair drop-in, and I was like, I'll give it a try. So she went, and she was like, imagine my amazement when I get there, and not only do they know my culture, I don't have to explain about black hair, they know what to do with it, they know my home country, they know my language. Like, wow, for the first time since coming to Canada, I felt like I belonged, I felt at home. And so she had this great experience at the hair drop-in, which at first thought you might think, what does that have to do with health? But then she heard about the other programs, the food security programs, the cooking groups, the food box, and she's like, well, I had a really great positive experience at the hair program, so now I'm going to try the food security. And this eventually led her to be able to connect with primary health care and finally get some of her health care needs addressed, which she did not have any connection to primary health care. So sometimes it goes from primary care out, but sometimes we can also build trusting, meaningful relationships to bring people in so they can get the health care they need. Just a few stories. So this is a picture of like what social prescribing can look like. So here is the hiking group from Taibu CHC. This is some pictures from a health fair at Black Creek Community Health Centre. So it's a health fair, but it's in the mall. They have live music, there's food. It's actually more of a community gathering. But while you're there, if you want to, you could get your blood pressure checked, you could get your blood sugar tested, you could chat with a dietitian, you could find out about some of the health programs and services that are available to you. So that's like, any door is the right door to access healthcare, so this can be a fun way to be in the community, but also reach people who might not be being reached. We have volunteering. That was the place where we saw the greatest increase in self-reported mental health, was where people were able to volunteer or take on a role, no matter how small, whether it was putting food in the bird feeder or leading a group. That's where people felt the strongest increase in mental health. And then we have Regent Park doing an art group, and I'll just skip this slide pretty quickly, but sometimes our partners with social prescribing are non-traditional partners. So we ran a walking group at the National Gallery of Canada because they were interested in working with us, and we needed an indoor place because our clients stopped coming in November. When it got cold, when the snow came, the walking group kind of dwindled, so we needed that indoor space. And then these are partners that anyone in Ontario could work with for social prescribing. 211, the Older Adult Centres Association of Ontario, the Ontario Caregiver Organization has some fantastic programs for caregivers, And this is something that even a busy solo doctor could access these services to be able to support their clients with social prescribing. And then these are the non-traditional partners that I started talking about. And so, if you're excited and you're interested and you want to get more involved with social prescribing, this is a tool that we worked on with the Centre for Effective Practice. So it's a tool for clinicians to use social prescribing, and that's available on their website. Oh yeah, we created 5 short videos about social prescribing in 5 different settings across Ontario, so including a nurse practitioner-led clinic, a francophone health centre, an urban health centre, a rural health centre, so you can take a look at those when you want to look at some fun videos. We have lots of learning events. And something I'm very, very excited and proud to share is we have a free online learning module for health equity focused social prescribing, which is available in English and French. So you can just self-register on our website to take a look at those modules. We also have an Ontario Social Prescribing Community of Practice that meets virtually every second month. Anyone interested in social prescribing is welcome to join us. And there is also a national community of practice. And we have these final reports on our website, and I do have paper copies if anyone is interested in digging a little deeper into any of our work. And that brings me to the end of my presentation. Thank you.